In our first community conversation, we're joined by Dr. Rebecca Dillingham, an infectious disease specialist with Sentara Martha Jefferson Hospital. She's sitting down with Aaron.
Dr. Dillingham, thank you for coming in today.
Aaron, thanks so much for having me.
You are very welcome. So you're here to talk to us about hepatitis C and kind of break down the stigma surrounding that. But let's first just talk about what exactly is hepatitis C and why are so many people still going without treatment?
Yeah, so hepatitis C is a virus that affects the liver, and it can be kind of one of those silent killers. A lot of times people won't realize that they're infected, and so it's really important to get screened. Everyone should be screened at least once. And the other really important thing is that there is a cure for hepatitis C. And you mentioned stigma, and I think that's something I'd really like to emphasize today, because unfortunately stigma prevents a lot of people from seeking testing and also treatment for hepatitis C.
Mm-hmm. Yeah, and are there like misconceptions or?
Yeah, that's a great question, and I think that one of the biggest misconceptions is due to the association that many people have of hepatitis C with substance use disorder. And while it is true that not everyone who has hepatitis C also has substance use disorder, it is also true that both nationally and Virginia, substance use disorder is the main risk factor that people report for hepatitis C. Mm-hmm. So unfortunately, despite the fact that so many of us are affected either directly or indirectly by substance use disorder, there's so much stigma around substance use disorder that sort of spills over onto hepatitis C and results in a lot of stigma around hepatitis C as well, which prevents people from seeking testing and also care.
And what can the general public do to bust those myths and break down that stigma?
Yeah, so I think one of the most important things to remember is how much progress we have made in developing opportunities to people with substance use disorder to seek recovery, both by implementing medical treatments and also because communities have mobilized so much. So this is the main thing that we can do to reduce stigma around hepatitis C, is also to reduce stigma around substance use disorder. Mm-hmm. Now, in addition, I will also say that we need to know the facts about hepatitis C. So hepatitis C is spread through blood. That's the way it's spread. So nobody should share anything that has someone else's blood on it, whether it's a toothbrush or a razor or a needle or a straw you might use to put something in your nose, or anything that has any blood on it. That's how you get hepatitis C. You do not get hepatitis C from sharing food or drink with someone, from having everyday activities with someone with hepatitis C. So I hope no one pushes someone away who has hepatitis C, but that they also remember, be careful when there's anything that has blood on it.
That is important to keep in mind.
That's right.
Well, thank you so much, Dr. Dillingham, for, it's always good to, bust myths and, learn the truth about things, things that we as humans kind of get wrong sometimes. So
That's right.
Thank you for coming in to explain that to us.
You're welcome.
Yeah, no, we really appreciate it.